We'll give everybody one more minute, still a little bit late, and then we'll get started.
Yeah, Chad, we still have a lot of people joining, so if we just get another minute or so.
Yep, that's totally fine. The other two wheels of the tricycle are here.
Did you just say I was part of a tricycle?
I did. I thought that was pretty nice.
That's a very pediatric, visual.
I thought that'd be right up your alley.
Yeah, I really liked it actually.
I could have said much worse, by the way.
You're totally good. And you might.
Let's say if you're going to be offended by that, we got a lot of work to do.
No, I loved it. I just caught that tail end of it. I was like, something cycle. I was like, oh, he said tricycle.
I do feel more like we're riding on a unicycle though. That's
A little less bounce.
It's like a seatless unicycle at that.
I think you're probably good to go.
Okay, I still see numbers clicking, but we will go ahead and get running. So welcome everyone. I see the chat room has already started off. That's great. This is good. So quite a few things to talk about. I won't say probably any major change for our last discussion, but at least some updates and kind of state of the union discussions. So depending on where you look and what data you follow, locally, it still appears that we are very much on the upward swing as far as case rate. And in fact, if you look at the hospitalization rate, it appears that within the next week, we will likely crest above the Finger Lakes region hospitalization rate that we saw in January of 2021, which was the overall peak of hospitalization for the Finger Lakes region. So we were kind of on this kind of rickety kind of climb and then shot up over the last week. And if you follow the projections out, it is very likely that for the next 1 to 2 weeks, we will still continue on this upward climb until we exceed our hospitalization rate that we saw last year. Obviously, that is not ideal. Interestingly, if you look around the country, Boston in particular, Boston may have already crested if you look at some of their data. So we are starting to see some of the UK and South Africa phenomenon of the rapid rise and then the kind of fall off a cliff decrease. So remember I talked about last week the wastewater sampling that they're doing of mRNA copies in Boston and that they've been doing since early in the pandemic, and that they've had like a 20x rise from the peak of last year in wastewater mRNA copies of COVID. So that crested end of last week, and now it has fallen precipitously, almost 30% in just the last couple of days. So granted, I don't know that sewage water in Boston portrays what we're going to see, but nonetheless, it does appear that in some of these larger cities that were hit hard and hit early, they already may be seeing a diminution in their rates of infection. Hospitalization rate, as we have said all along, will continue to linger. And like I said, we probably have at least another week or two, even if things go as well as possible, where we're going to see high rates of hospitalization just because the volume of people that are infected. I will also say, and I think we touched on this before, perhaps the first time since the pandemic began, we've said all along that for the last 6 to 12 months almost now, that this has become a pandemic and surge of the unvaccinated. And I think that is probably never more true than now, where if you look across the region and the ICUs, almost without exception, the only ICU patients, and I think right now exclusively those who are ventilated, are unvaccinated folks. If you look at the vaccinated who are getting admitted, almost universally, they are coming in for something else and found incidentally on screening to have COVID. So for those who are vaccinated, even those who are vaccinated not boosted, they are generally showing up for some other complaint that is not seemingly directly related to the fact that they are COVID positive and they're just found to be COVID positive. So that, I won't say it's good, but it does largely say that for those who are vaccinated, which is 70% of our population, even if they contract this, which is still much more likely than it probably has been even with Delta for the vaccinated group, many will be asymptomatic or very mildly symptomatic, it appears, which is good. It also appears that the resolution is faster. So if you look at the length of stay of hospitalized individuals now versus at the peak of Delta, the length of stay is low. And it's at a time when monoclonal antibodies are less available than they even were 6 to 12 months ago. So some of the armamentarium that we thought were probably moving patients along quicker before and decreasing some of the morbidity and mortality that we saw in hospitalized COVID patients when we were dealing with the alpha strains. Now we don't have those as readily available, but yet the length of hospitalization is diminishing. So if there is a light at the end of the tunnel, it does appear that in some places, if you're looking at the data, we may be at the crest point and starting to come down. Certainly, the herd immunity fascination continues to be a discussion, and whether there will be, I've started to see the Deltacron strain is now the kind of getting a little bit of press, but more and more, either because of vaccination and or exposure, it seems to be the thought that if there even is really a Deltacron mutant hybrid strain, that we likely will have some degree of immunity against it because of the vaccination and the exposure rate that we've seen. So we may very well be able to ride Omicron into the endemic phase of the pandemic, which would be good. But certainly, I think the next week or two from a healthcare perspective and hospitalization perspective and staff absence is likely to be our worst phase. And then hopefully, if we get through that next couple of weeks, if the gods are with us by the beginning of February, we may start to see a little bit of a light at the end of the tunnel. So that's the good news, but certainly more to come. And I think I've talked about lights at the end of the tunnel multiple times, and it just seems to be a series of trains. So we'll hope that this one is a real light and that it's better this time. So that's the good news. The next big topic of discussion that has even raised some email questions is about the governor's booster mandate. So again, this is largely for those who are in Article 28, Article 31 facilities. So if you're in a nursing home, if you're in a hospital, if you're an employee of those entities, this applies to you. For private practice healthcare providers, it still does not extend to that group at this point. And although the state and the governor's office has said that they would intend for this to extend to all healthcare providers, it is not clear that they have that authority to do so at this point. And we all know that the federal mandate is actually, or just was heard by the Supreme Court, but we do not yet have any ruling on that, even though it did seem that the Supreme Court in their questions were likely going to be in favor of upholding the federal mandate. So at this point, the booster mandate has now been approved. We do not have a timeline for implementation, although we anticipate it will likely be within the next couple of weeks. That booster mandate says that you must receive the booster within 2 weeks of the manufacturer recommended timeline, but that would be 5 months after getting the second dose. So even for those employees who, kind of were the last ones in, so to speak, who were hesitant to get vaccinated and only finally got vaccinated when the first vaccine mandate kicked in, those folks will have 5 months before they will qualify for the booster. And then we'll have another couple of weeks to get that accomplished. There will be no test out option, and the medical exempt option will be no different than it was for the vaccine mandate, which is to say you must actually demonstrate that you have some reaction to the vaccine itself. Everything else really doesn't carry water. So that booster mandate will be going into effect soon. There has been a lot of lobbying just because of where we stand in the pandemic and the concerns about the potential additional staffing shortages in hospitals and nursing homes. that the state delay that implementation, but the governor seems to be fairly committed to moving forward. And I think we all can agree that one way to preserve staffing is to have people boosted so that they don't go out. We all know that there's going to be people who, were hesitant to agree with a first or J&J or second dose of Pfizer, Moderna, who will absolutely not get a booster dose. And so they will opt to leave healthcare or go somewhere else to practice rather than consent to that. So that's a concern. Just lost my train of thought. Oh, I know the other thing that's catching up. Yeah, I know that there's lots of things floating around in there. It's terrible. So some of the anti-vax and even some of the vax are starting to, I'll say, complain that the old adage of, that the anti-vaxxers use, that this is just going to be a 4 or 6 dose vaccine and it's just going to be constantly get another dose, get another dose. We are now looking at a 3rd dose booster. If those were immunosuppressed, they were supposed to get 3 doses and potentially a booster. There's now discussion of an Omicron strain booster that will likely be coming out potentially within the next month. And then there's also discussion of what I'll call mega COVID vaccine that will cover past, present, and future strains that would become kind of the standing vaccine of eternity that we get every year, like with our flu shot. So in that case, we could be getting to a 4 to 6 dose vaccination regimen that has got even the most arduous a little bit off put by this whole discussion, especially as some people do get sick after their booster dose, even more so than got after a second dose potentially. And by sick, I mean usually it's 24 hours of feeling like crap and then back to business. So I do think that's being pushed more and more as a reason that people are hesitating. I know in the hospitals, we've already had a few people say, if there's an Omicron booster coming, can I just wait to get that one if I'm going to have to get a booster? I don't really want to get a booster now and have to get another booster, whenever this Omicron booster comes available. We really have no direction about any of that from the governor's office, but it appears that the intent will be that the currently available booster will be the one that will be required under this mandate. So I'm sure there will be more to come. I can tell you this is an active discussion, but because all of this is so fresh, we really don't have any firm guidance about that at this moment. The other piece, and I'm sure LJ and Renee can talk more eloquently. Renee did a little bit of investigative journalism last night, but Elizabeth Murray brought up the Centers for COVID or COVID Centers of America, or whatever, the testing modality that was on Mount Hope that we had advertised, I think, last week as being available as a place to get testing. And Elizabeth had brought forward that in Florida, there was a charge that they were using fake COVID tests and just giving negative COVID results. And that basically this was a phony kind of anti-test operation. Come to find out with what Renee came up with, this is a couple that have had a series of unfortunate businesses, including axe throwing bars and other fun establishments, who seem to have decided to make a buck off of the desire for COVID testing. And so the reliability of this outfit is significantly in question at this moment. So as much as the world would like to have another outlet for free and available COVID testing, I think it is hard to say that that outfit should be trusted at this moment. It may be that this is the nunnery arm of COVID Centers of America, or whatever they are, and that they're very upstanding people, but doesn't seem so if you look at all the literature that's been published on them in the last couple of days. So whether or not they will still be in business at any one moment stands in question, but it raises enough of a concern that I would be hard pressed to say that that's place worth referring patients to. And obviously it's already kind of circulated because I think patients are all trying their best to get access to COVID testing. So I'm sure people are finding this on their own, unfortunately. There you go, Center for COVID Control. I knew I didn't have the data or the name quite right. But even in the information that Renee found, it was pointed out that they did their very damnedest to come as close to CDC as they possibly could, so that it sounds very supportive and familiar to people, and that way people feel more comfortable with it. So unfortunately, what we thought may be a good avenue does not appear to be. So just that people are aware. The final piece for me that goes along with testing is you probably heard, I think it was Monday, the Biden administration announced that they would be enforcing that payers would have to cover 8 COVID tests a month, which sounds really great. The problem is, where do we get those COVID tests from? And so they still are not readily available in the community. There is talk about 500 million that the government has signed a contract for. They signed the contract for them last week. So they are supposed to be able to begin distribution within the coming weeks. So it's not that 500 million are suddenly going to make it to the street corner near you. It's that the government has purchased another 500 million that probably are in production somewhere as we speak. So that remains a significant impediment at the moment, because while all of us want to be using testing to try to do the right things, testing resources are in short supply, to say the least, at the moment. And even the PCR testing, which is not necessarily in short supply, the turnaround is progressively longer. So especially when you start looking about this contingency phase that the CDC put out, where people who are 2-dose but not boosted, vaccinated, and exposed can come back to work as long as they're masked and tested on day 1, 2, 3, and 5 through 7. At this moment, if you got a PCR test on day 1, the result would not be back before you had to get your second and third test on day 2 and 3. So that makes an extra dose of complication, to say the least. So lots obviously ongoing. I think we have learned multiple times during this pandemic, we are often playing catch up. And I think we are in that phase right now. I think the other thing that we're starting to hear is that as people are seeking boosters, especially those in the healthcare community that have been holding off on boosters to this point, that booster appointments are not as easy to come by as they were even a few weeks ago. So community pharmacies, where it used to be you could pretty much just walk into your local CVS and find a booster, a la what I did. Now, I think we tried the other day, and the closest one I could find was about 7 days out to get a booster appointment. So they are available. We'll see for folks who are looking. People cancel those appointments fairly quickly, as they either find an alternative, get a booster at work, presumably, or whatever. So if you keep checking back, they are seemingly coming available at the moment's notice. But if you're trying to prospectively schedule one out, it can be a bit difficult at this moment. I will say it does appear, if you go out in the region a bit more, it is a bit more available. I know down in the Livingston County range, Quinlan Pharmacy in particular seems to have a pretty readily available booster appointments that you can get into. So that's another, if people are willing to travel a couple minutes down the road. I know the hospitals are all gearing up to kind of reemphasize their vaccine clinics to try to get folks access. So I do think that at least those who are employed by hospitals will likely be able to get access very easily through their employee health. But for folks who are in your offices, potentially they're looking to get boost appointments. I don't know that the hospitals at this moment have enough supply or manpower to offer a come one, come all. And so if you're doing it through community pharmacies or through primary care offices, I think it's a bit more of a delay at this moment to try to get to them, unfortunately. So I think that's all I really have to share. So I will hand it over to LJ and take a breath. Oh, good. New York State site, so love appointments. That's good.
Yes, that is good. So I think the focus for me is going to be talking about the ever-changing school guidance and try to state where we are right now, what the questions are that are still unanswered that we're looking for some guidance and clarification around. And then I would just trust you all. If I am missing something big that is an outstanding question, I know that all of the providers on the call are getting inundated with questions from their families and their patients about what this all means. And so we're trying to provide sort of the new primer of guidance that you can refer to, translated guidance. So that being said, Renee, is it a reasonable thing to just show people for a second what we're developing? Okay, so recognizing it's even hard to keep track of all of the changing guidance as we're putting it out to you all, Renee is guiding you to the AHP website for a moment. If you click on now the little floaty thing that comes up when you get on our website that you keep trying to get out of the way, that is going to be what you click on to be able to get sort of up-to-date, daily, updated current information around return to school. And we won't continue this forever because I hope at some point the guidance just stays the same, but for the next few weeks anyway, this is what we have here. So the header part of this is what I want to just highlight today. We're going to try to have a daily return to school information summary and just hit the high points. What has changed in the last 24 hours, if anything, or what's a big deal for this week that you can, just look at this really quick and see. So the big announcement for today, I'm going to walk through this with you while it's up because it helps me because otherwise I don't have to look down at the piece of paper on my table. The big thing of today, not unexpectedly, we heard from the health commissioner, Mary Bassett, and then Governor Hochul, that the county health departments are no longer obligated to do contact tracing. I think we were all recognizing this was starting to happen because people weren't getting calls, but this is official at this point. And a lot of that is due to Omicron variant short incubation period, but also obviously just the record-breaking case numbers that we have. So the main focus around contact tracing, well, along reporting, and then requests for isolation orders and quarantine orders is going to be electronic. And over the weekend, we forwarded to you the information from Monroe County for the site that you can have your families click onto to provide information about their child. What we have heard, I think Renee's looking to, it's okay, I don't think you need to pull it up right now, Renee. What we have heard is that the state is going to have a reporting site, but I have not seen anything released on that. So the good thing about the state having a reporting site is that should help with outlying counties that haven't stood up something on their own separate. So stay tuned, check back on this page. We will put the links in. And I think that at least it's something you can guide families towards. Having gone onto that site, I can tell you what a family needs to do is they have to input their child's name, relevant information, the date of their test. So this would be whether you got your test done in the lab or you did a home test, the date of their positive test. If it's a home test, you upload a picture of that home test, and then you also report when their symptoms started. And so your day 0 is either the day of symptoms start or date of positive test, whichever came first. It automatically calculates out a release order that will be 5 days out from that. And that's how these reporting sites work. And then there's another button you can click onto that basically, if you say looking for a quarantine order, you report similar things, get a similar piece of information. So we just have to be able to find out if the state link is going to supersede the county link, or if there's going to be a Monroe County link and then a state link for counties that don't have one of their own. So we will get that to you, I think, before the end of the day today. The next critical things are, and I think everybody is oriented to this now, but that the isolation period for COVID positive students, regardless of vaccination, is 5 days. The caveat I would put to this is it's really important to understand that that's their isolation period, provided they're fever-free for 24 hours off antipyretics and their symptoms are either resolved or improving. And I think this is a really important point to reemphasize. There should not be febrile kids coming back into school. There should not be kids who are actively, not doing well going back into school. And so that's a place where I think your clinical expertise may be called into play at times. Now the latest guidance that we have highlighted down here below, and Renee's got a little click here for info, emphasizes a difference about quarantine requirements. Quarantine requirements do differ based on vaccination status. And that's sort of the latest thing that came out on January 6th. And then there was an update from the state also on the 10th that highlighted that. So Renee's got both of those below. And so the difference on vaccination status is that if you're fully vaccinated and if you're eligible for a booster, you're boosted. But if you're fully vaccinated and you have an exposure, close contact exposure, you can continue to come into school. There is not a quarantine requirement on that, though masking obviously is really important and people are supposed to still limit their contacts outside of school activities. But if there is an unvaccinated individual, and so that certainly applies for all of our younger kids who do not have, the opportunity for vaccination, or for kids who've not been vaccinated, they do need to do a 5-day quarantine. And then they can come back in. Again, all of the masking recommendations in place. And all of this is precluded on, the assumption that they are asymptomatic. If they become symptomatic, they need to test. I understand from a text message I just got that the county, Monroe County, is redoing all of their algorithms right now to reflect this. So as we get those algorithms, we will post those in. But we didn't want to leave old algorithms on here active now because they don't apply. It's very, very confusing. Reminder, antigen tests. We highlighted this week, and I just wanted to make it clear. It's a little bit confusing in some of the language that's coming out from state and county. They use a terminology about what type of antigen tests are allowed, meaning like where it's done. And we just want it to be very, very clear. Antigen tests perform where there's a limited service lab license in place or a full-fledged lab count. So your practice settings, schools, test centers, laboratories, all of those are permitted for return to school purposes. There has been no change about antigen tests performed at home. This is for negative tests to come back to school. If it's a positive test performed at home, positive test is a positive test. But just to be really clear, home tests are still not allowed for a return to school with a negative test. Test to stay got very narrowed in the last week. So test to stay really only applies to asymptomatic unvaccinated students who had an exposure to an infectious individual while in school. So that would be, in a classroom perhaps where people are not masking fully, or at lunch or something like that. So that's really the only thing that applies for test to stay. There's way too much community exposure now. And so they're not allowing test to stay in cases of community or home, family exposures. 2 more things, and then I'll shut up and see what questions you all have. The return to exercise protocol. Wow. This one has been really rough for people to understand. And it makes sense, right? Because I think everybody thought as soon as a kid is out of isolation, they should be able to come back, to their full activities. I just want to take everybody back to December. We really looked at what was happening with our local data, compared it to what available information there was about national data. And we narrowed the scope of kids for whom this return to play assessment should apply. So it is at children of any age who have had moderate to severe symptoms. These are kids who really are sick, right? And who aren't going to be getting out of isolation at 5 days anyway. And some of them are hospitalized. But that group of kids requires that return to play assessment from their healthcare team, and potentially even the input from a cardiologist for the severe kids. The other group that is considered still to be at more risk potentially from COVID infection are 12-year-olds and up, but not all 12-year-olds, 12-year-olds who are participating in high intensity competitive sports. So none of this stuff, we really made some changes in order to not, hopefully you're focusing on the group you most need to focus on, as opposed to everybody in the world. Somehow that communication still was missed, I think, by some of our healthcare providers. It was missed by some of the schools, despite putting things out. So we're trying to re-clarify that this doesn't apply to everyone. And based on the clinical medical information that is available right now, which there's a very limited amount of information known about Omicron, except for the fact that we know a lot more kids are landing in the hospital than previously, we can't just shorten this to 5 days, because we don't really know that impact. The clinical recommendation is that the assessments start at that 10-day mark. And you are all getting tons of pushback from athletic directors and parents who want their kid right back into their sport. I would just encourage people, this is a clinical recommendation. This is not a recommendation that's based on when you're considered infectious or not, which is what quarantine and isolation are really about. We have requested more information from the AAP and from their team that's working on this. What are they thinking about in this space? And we will keep you guys posted and updated. But at this point, our cardiologists locally and collaborating with others around the country feel like the 10-day assessment still makes sense in this limited or somewhat limited group of kids. All of that information has been shared, reshared, reiterated by the county with all of the school districts at this point. And I know there's still going to be questions, and I know right now there's still questions and pushback. So we're trying, if you get something that's not fitting in this, shoot me an email like you have before. I'm kind of lifting it through the school district superintendents. So hopefully we can have conversation and education and get to a point where we're not all fighting about it. I think that the last thing, this is just again highlighting the information about for 12 years and older kids who are eligible for a booster but not yet boosted. For those kids, their ability to come in after an exposure with COVID-19, it just applies to curricular activities, not extracurricular after school at this point. That is information that came out from the state. I'm taking a breath. So here's the questions that I know still exist from all of you, and that I have as well. We are trying to make sure that there will be some documentation coming from the county or from the state that emphasizes the issue that students coming back from isolation should be fever-free for 24 hours, because it doesn't say that anywhere that we've got right now. And also that isolation could occur anywhere, or return from isolation could occur at any time between that day 5 and 10. It's not like you only get day 5 and then day 10. If they get better, they can come back in that time. We're hoping to get some clarification in language. There are lots of you who have reached out and asked about this. The one big question that we don't have information on is little kids. There has not been stuff put out that's been made clear about recommendations for childcare, recommendations for younger kids who can't keep their masks on. I have to assume that all of this guidance has been put out with the idea that these individuals can be masked. So for the moment, until we get more clarification, I think these guidance documents really only apply for kids who can, keep their masks on at all times. So otherwise it would be the old 10-day rule. If we get something different, we'll let you know. And then I think that we really are asking for clarification from the county health departments and from the schools about what is happening with kids who have had COVID, go back to school at this, 5-day mark, and then are unmasking for lunch. And is there guidance being given to the schools about, separating these kids or anything? And so many of you have raised those questions as well. I don't have an answer yet. We're going to work on it. And it's an important question about exposures. So there's lots of questions in the chat and I couldn't read them and speak at the same time. And I don't hope what I said was clear, because honestly, I can't imagine how you're fielding a million questions from families, because I have to stop and think and pause every single time I open my mouth now before I speak about this, because it is confusing. So I think we should just acknowledge that. And we're trying to get speaking points for people. There's a lot more gray than black and white nowadays, and that's hard. Anybody want to elevate the questions out of the chat?
Sure. Do the 12 and older kids who are vaccinated but not boosted and have been exposed, do they need daily tests to return to class if they remain asymptomatic?
So this is exposure, not infection?
Yep.
No, they do not need daily tests. Oh, got the first one. No, I'm joking. It's really, I feel like I'm on a game show.
We heard that a school district is having parents sign a waiver to go back to sports without a cardiac clearance appointment. Is this allowed? Well,
so I would just say again, those words RTP to me are becoming like it's a bad 3-letter word. I would just say this is guidance. This is the best available guidance that can be given. These are not mandates. They have never been mandates. It's not stuff coming from the state. So I think we offer the best guidance we can, and we do the best to educate and so that people understand the reasons why. But we can't legislate what any school district is doing. However, whoever put that in the chat, if you want a private message, what that is, who that district is, maybe we'll be able to engage in some conversation with them.
I have patients coming to the follow-up after mild or asymptomatic illness who are already exercising, dance class, treadmill, shooting hoops, and are ready to go to practice. Do I need to advise the gradual return even though they have tolerated over an hour of steady exercise prior to the visit?
So I think part of the question in here is, by the time they're getting to you, if they've already been doing all of those things, I'm assuming they're closer to the 10-day mark already. And I think what we had said before is that if these are athletes who are competing, I mean, that's one of the things. I think their athletic trainers should still be watching these kids at least to see, but we had talked about not needing to totally backtrack. You might be able to say that kid is already performing at level 3 or stage 3, just work them through the next piece. I hope that's what you're asking, because that's really the only group I think this would apply to with mild or asymptomatic. It would be the 12 and up athletes. I think using your clinical judgment in that space is very, very reasonable. The bigger worry is people who are demanding a visit at day 5 and their kids haven't really been doing anything yet. Dave Topa, unmute and speak. I see your hand up.
No, it's just there's some school districts or some schools in particular that won't even recognize that return to play protocol starting before age 10 or before 10 days out, which I don't know if that makes sense clinically, because if we think of all the inflammatory complications, they tend to be delayed anyways. So
Yeah.
I've been telling families that's why we're just doing it at day 10 and starting the RTP at day 10. But
yeah, you're right. You're right. It's a clinical recommendation. It's a totally different thing from an isolation quarantine question versus what are the potential effects of this disease process on a child's heart that we don't know about. So this is out of caution at this point and based on recommendations from specialists across the country. I don't know how else to put it out there in a way that makes sense to folks. An extra 5 days just to be sure things are looking okay seems a reasonable trade-off to me. We got a lot more in there.
There was a question that Chad answered. How long after receiving the booster are they considered fully vaccinated? Chad responded 72 hours after the booster. And Mendon Pediatrics also noted that they are having issues related to Ontario County still not accepting antigen tests for return to school.
Oh, okay. We'll take that one offline and we'll take that back today and see what we can find out. Thanks, Lyndon Peets.
Something in the chat, LJ.
What's that? That's it in the
Yeah.
chat. Okay, so
One thing I did want to point out, Michelle Foster noted that some counties are continuing contact tracing for schools at this time. So, I mean, I think we can, LJ, you and I can certainly acknowledge that our ability to keep up with every county's status has been such a challenge, but we're trying.
I do know that the schools reopening task force, with Michelle's help, have been doing outreach to all the individual counties to try to get more information. And as that gets consolidated and pulled together, and updated, we will share that as we know that information, because we recognize that you are all taking care of kids from multiple different counties, even within your one practice. So we will do our best to gather that information. In the interim, I think the best advice I could give is if you have a question is either trying to reach that county health department directly or going on their website to look and see what information they have posted.
And if you can't, this is Michelle. If you can't, reach out to me and I can try to help.
Michelle, you are a good partner. Michelle
try to
is
help get an
part of
answer.
the SATU network, and so interfacing with all of the Finger Lakes counties. And thank you very much for being on the call and for that information. So Michelle, I'm going to ask you right now, maybe a little outreach to Ontario County on your part, just to find out this thing about antigen testing. That would be amazing.
Yep, got it.
Awesome. Are there other questions of the team? I wanted to give Elizabeth Murray a moment, just to give her, I don't know, it's always an interesting thing to get your
A moment of silence.
Update.
I think that's what we need, a moment of silence. My pandemic bingo card is weirder and weirder by the day. Actually, the only big thing I really would like to just let people know about, based on a request at a meeting yesterday, there's gonna be a lot of updates to the GCH COVID website. What has already been updated on there in the vaccine section. If people want to read all the consent information and all the EUA information, all those pages that you go through with the parents before the child is actually vaccinated, that's all available online. So people can review it ahead of time. There was requests by many parents apparently wanting to look at it ahead of time. So that is all there. And we are in the process of updating all the stuff on the website because some of the guidance is old, and we're working on that and increasing information about some of the hot topics on fertility. The big thing now is a study that came out showing that women might have a little bit of a change in their menstrual cycle after vaccination. That change was about a 1-day difference in onset of menstruation. Not a big change. And the news, actually, some of the news coverage has been very reasonable and some has not. But we're gonna get some information on that there too. So that's what I've got for you today.
Thanks, Elizabeth. I would just remind everybody that we are seeing, and I hope that you all are seeing in your practices, more outreach now from families who want to ask questions about the vaccination for their children, for themselves, and more people beginning to schedule for a vaccination. It's not like the faucet turned on, but it definitely opened up a little bit. For any of you who are not able to provide vaccination for your pediatric patients or their families, Golisano Children's Hospitals was the La Chase vaccination site is about to do a pivot. They're going to operate out of Golisano Children's pediatric practice on weekday evenings, certain weekday evenings and weekends, and they will be able to do the entire family. They will be able to do the 5 to 11 as well as older kids, boosters, adults, first doses, whatever it is. And so I just wanted to make that resource known to you. All of that information would be able to be accessed on the GCH website that Elizabeth was mentioning, and we'll include that COVID resource page in our messaging. And I would say again, anything you can do to continue to promote the importance of vaccination for children and families through your social media sites, through whatever outreach you're doing to your families. People are beginning to listen more, they're beginning to question more, they're hearing these messages about the difference between vaccinated and unvaccinated and what impact that has on disease. And I hope that will translate to more people getting vaccinated and having their children vaccinated. Our numbers are still rough, gang. We are only around 32% for children 5 to 11 in our area. And we've been doing this for a while now. So we got a long ways to go. We appreciate everybody's work on that. I think this is not for lack of effort, not for lack of availability, but maybe.
Last second question to the chat, LJ, that I don't have good information on. Any updated information on the link between type 1 diabetes and COVID in pediatric patients that was referenced by CDC? Our practice has seen 3 that would meet the criteria.
Jane, that's Jane Pardee, right? That is such a good question. And actually, I elevated that, and seeing that same report, elevated that to our endocrinology team to ask for and also to the infection prevention and pediatric infectious disease folks who are looking at the COVID guidance. So I would ask, I don't have information yet, but I hope we could bring more back to you at our call next week. I think that's everything. Renee or Chad, anything else?
I got nothing.
No last minute questions? Wow, it's a lot. Hang in there, everybody. And please continue to reach out, and we'll be here again next week. Sooner if all hell breaks loose.
Thanks, everybody. Have a good week.
Bye.